How much does seminoma cancer treatment cost? When it comes to understanding the costs of treating seminoma, a common type of testicular cancer, it can seem complicated. The total price depends on how advanced the cancer is, the treatment options chosen, and where the treatment takes place. For early-stage seminoma, which is usually confined to the testicle, treatment costs generally range from about $17,000 to $26,000. This includes the initial diagnosis, which involves blood tests, imaging scans, and physical exams. The main treatment is often a surgical procedure called a radical inguinal orchiectomy, where the affected testicle is removed. Follow-up care, such as additional imaging tests and tumor marker blood tests, is also part of the overall cost. If the cancer is more advanced or has spread, treatment costs can increase significantly. For example, in cases where chemotherapy or radiation therapy is needed, costs can rise to around $40,000 to $52,000. Chemotherapy for seminoma often involves drugs like carboplatin, which can be administered in outpatient settings, but the costs add up with multiple cycles. Radiation therapy, which targets remaining cancer cells, also contributes to higher expenses. In some rare cases, more aggressive treatments like high-dose chemotherapy with stem cell transplants might be necessary, which can cost over $500,000. However, these are reserved for very advanced or resistant cases. Another important aspect to consider is fertility preservation. Since treatments like orchiectomy and chemotherapy can impact fertility, many patients choose to bank sperm before starting treatment. Sperm banking typically costs between $1,500 and $2,500 for storage over 3 years. This is an important consideration for many men who want to maintain the option of having children in the future. Overall, the cost of treating seminoma varies based on the stage of the disease and the treatment plan. Early-stage treatments usually fall between $17,000 and $26,000, while more advanced cases can cost nearly double that or more. While surveillance after surgery might seem less invasive, it involves frequent visits and scans over several years, which can add up and sometimes make it as costly as active treatment when considering salvage therapies if the cancer recurs. It's essential for patients to discuss their specific situation with their healthcare team to understand the expected costs and explore options that fit their medical needs and financial circumstances. Always remember, personalized medical advice from qualified professionals is key to making the best decisions for health and finances.